Welcome to our second webinar that we organized with our organizations on this particular time, of course, and on the different aspects of the coronavirus crisis all over the world. As you probably have seen through our Facebook group, Facebook event, today's topic will be on the multiple crises in the global south, and we're very fortunate to have interveners from all over the world. First and foremost, we have Camila from Ecuador, who is an urban feminist woman. She's an activist for human and nature rights, and she lives in Quito, the capital of Ecuador. She studied journalism very well. If you can wave again, Camila. Perfect. Second, we have from Ghana, Benedicta Lasi. She's a lawyer, and she works in a Ghanese law firm in Ghana. Therefore, she's the vice president of the International Union of Socialist Youth, and she aspires to become a UZ president in the next Congress. At the moment, she's immediate past coordinator of the Africa Committee, and of course a young leader in the National Democratic Congress of Ghana, which is the main opposition party in Ghana. Third, we have from Brazil, João, if you can wave. João Ramos, who is a political analyst, and he's a member of the Workers' Party Youth, who studied international relations and has professional experience in the security sector. Of course, you will be, I'm sure, able to tell us very much a lot about the whole situation in Brazil, and especially being in the opposition, of course. And finally, we have from India, Saima Azim, if you can wave. Hi. She's a member of the Young Voters Party and the former international secretary of the Young Voters Party in India, who is apparently the youth wing, of course, of the Voters Party. She's involved in political activism and is also pursuing research. So welcome everyone. I believe we're all in complete. So because we have many topics to cover, of course, and as I mentioned, we make sure that we leave some time for the Q&A. Very shortly, I will ask every one of you, if possible, to present in a short manner the most important issues regarding COVID-19 in your country at the moment. If you want to start, Saima, feel free.
Yeah, so the most important issue that we're facing in India right now amidst the lockdown is not just the lockdown, but because in India we have the largest lockdown in the world, which has impacted a huge population of 1.3 billion people. So it has resulted not just into this problem where people have to face a pandemic, but it has also resulted in a massive humanitarian crisis in itself, because of the lockdown, a lot of migrants had to move back from big cities to their villages and hometowns, which has resulted into a massive issue of hunger, crises, and it has resulted into a health issue as well, because amidst the pandemic, the social distancing happens to be the most primary factor that's being informed to people again and again, but with the kind of population that India has, and the problem with the migrants who don't really have a place to stay because of the lockdown and the economy sector being shut down, they don't really have a place to stay. So they have to go back to their hometown, which has resulted in a massive breach in terms of protecting ourselves in this time of crisis, and that has emerged as one of the major problems in the middle of a pandemic itself. There are other issues with the pandemic also, in terms of the doctors and the healthcare workers and the frontline workers not having enough PPE kits and not having enough facilities to ensure that they are safe while they provide care for the people. They're at the front of this pandemic, and also they're also a massive number of deaths that have happened to these people also. The nurses, the doctors, the people in the police sector or in the administrative sector, they have also suffered massive losses because of that. So this has primarily become a major issue in India right now. So hunger, not proper medication, not proper protective care for the doctors and the frontline workers, the general problem that happens because of such a massive lockdown that has happened in India, which initially was a 3-week lockdown but has extended to a 5-week lockdown. So our economy was already suffering massively, but because of the lockdown, it's been a massive, unprecedented amount of impact on our economy, which is going to trickle down once the lockdown is over also. So these are the primary problems we're facing right now. Thank you.
Thank you very much. Of course, as it's been said many times, the health crisis we're going through right now not only is a health crisis and unprecedented circumstances, but it also highlights huge voids that have been present for the past years, even before, on social rights, human rights, of course, but especially social protection of workers, or in that case, of people who cannot work anymore. It also highlights inequalities inside our countries and all around the world, leading to discrimination even in front of death, in situation where, particularly because health should be the priority, social status, social situation, legal situation should not count as to who has the right to live or die. So indeed, I do believe that in India it's particularly prominent. But as you probably will tell us as well, João, in Brazil, this situation, I believe, has highlighted also the rage against the government policies and the inability of the government to face it and to choose economic situation, for example, over the health of its inhabitants. But if you please would like to tell us a bit more about that.
Thank you very much, Clémence. That's true. In Brazil, we have a crisis that's composed basically by 3 elements. 2 of those elements existed prior the pandemic outbreak in Brazil, and one is the sanitary question, how disease is going to affect Brazilians and cover a cost of lives of people and infrastructure in Brazil. But we are facing an economic crisis that lasts in Brazil since at least 2015. Unemployment grew a lot in our country, and economic has been shrinking for a few years. That's been a challenge for every government that came during this period, but particularly to Bolsonaro, as he promised once he was power, he will make economic growth, make people employed. So we are expecting this crisis to deepen and to increase with the crisis of coronavirus in Brazil. But other elements of these problems are political ones, and Bolsonaro is using the pandemic to politicize the situation and rival with other forces within our politics, like the Congress and the Supreme Court and states governors. Since before the pandemic outbreak in Brazil, Bolsonaro has been convening demonstrations against institutional powers in our country. He claims Congress and Supreme Court are opposing him, and so he must have more power in order to govern. He is using the crisis to affirm that our country is going to face even harder economic problems. This is not his fault. So he's using a very aggressive tone against the opposition and other parts, and he's searching to convince his supporters to the streets, to take the streets. He affirms coronavirus is not a serious disease, it's just a small flu, and people should get back to work. Due to the measures government has been taking in Brazil, we have basically no plan to face the pandemic, no plan made by the federal government. We knew that coronavirus was going to impact Brazil since at least January this year. But governments should choose, as I say, to affirm coronavirus was not a serious disease, and we should not take any measure. So we have now 41% of our workforce that's employed in poor conditions, meaning that they do not have stability, they do not have rights, or they do not have even any guarantees they can make a minimum wage, which in Brazil is $200 monthly. So Bolsonaro never planned for the pandemic, and we have no measure to protect people, jobs, how needs. And we do not have any infrastructure by the national government to face the pandemic. We are not testing countries that test the least in the world. It's around 29 people by 100,000 inhabitants. And we have no dimension on how pandemic is going on in Brazil. We know for a fact by official data that we have at least 2,500 deaths and 40,000 people infected. But as tests are really low in Brazil, this number can be higher, up to 7 times. Bolsonaro is using, as I say, this situation to rival some parties of the political establishment in Brazil. As Brazil is a federation, states and municipalities have a huge amount of power while in deciding how to provide healthcare and to control territory. Like to issue a quarantine is a matter that should be decided between the federal government and the state government. So state governments are trying to force Bolsonaro to make a federal quarantine, but Bolsonaro keeps denying quarantines are necessary and people should go to the streets. So he's threatening and telling people that governments are trying to destroy Brazilian economy, and opposite parties are trying to destroy Brazilian economy. This has really vicious consequences because we have a lot of places where people and governments cannot keep people home. It's really difficult to keep people home while the president's telling them they can go to the streets, they can keep living their lives like nothing is happening because the disease is not serious. In terms of infrastructure, now our situation is preoccupied due to the inequality in Brazil. Brazil has a very decent ratio of mechanic ventilators and intensive care per inhabitant. But the problem, the roots of the problem there is that this is enough for some states, especially some regions within the southern states, but some parts of northern Brazil are already collapsing due to coronavirus outbreak. One element that became very clear for us in Brazil is the need of universal healthcare and state structure that can attend the people. We are not facing a major disaster because we have here an universal healthcare system that's able to provide basic attention, it's able to provide intensive care for people that already have coronavirus or demonstrating symptoms or are requiring attention. But even though our health system is being jeopardized by the neoliberal agenda from Temer government and Bolsonaro government that came on since the coup d'etat that took President Dilma Rousseff from her presidents. And those are the main elements we are facing here. It's, as we see here, is a 3-part crisis. We have basically no response for our government. Almost all of the measures taken in Brazil were made by state governments or by the opposition in the Congress. PT, among other leftists and opposite parties, managed to pass a basic income decree, so we can pay 120 reais, $120 per people to help people to sustain during the crisis. Even with that law, Bolsonaro took almost 3 weeks to make it available for the people. The main problem we are having here is how crisis has been politicized by the government to jeopardize democratic institutions and to try to save Bolsonaro's agenda and to make incapacitated so he can ask for his supporters and part of the population to support him to ask for more power and to shut down some democratic institutions such as the Congress and the Supreme Court. As we saw, maybe you were able to see in newspapers, we had almost 24 hours of protests this weekend where Bolsonaro supporters took the streets and asked for Bolsonaro and the armed forces to shut down the Congress. He even spoke with his supporters in front of the army's headquarters while people were chanting him for make a coup. So this is the scenario we are facing in Brazil. We are lucky to have a universal healthcare system here that can make us prevent a larger disaster, but we have basically no idea of how many people are infected, how many people are dying from coronavirus, and government is making no response. Instead, he's using this crisis to rival with other forces within our nation. Thank you.
Thank you, Joe. Yes, as you mentioned, the foolishness of some political leaders, but particularly their willingness to sacrifice health in face of economic losses can lead to huge disasters, as we could see in the United States. On the other side, distrust in government can actually lead to health crisis like we saw in Iran, where the people were so distrusting of the government that they did not listen to the government when they told them to stay inside, and that contamination was coming near, because the government was so no more trusted by the people. And I do think that in Brazil, the contradiction of information as well must be very confusing for many inhabitants. Benedicta, I believe you are also very criticizing of the handling of the crisis by the Ghanese government. Could you maybe tell us a bit more about it?
Okay, thank you very much. I think that as Joao and Saima reiterated the point about the onset of the crisis and how we've seen governments around the world respond to it. Some would criticize governments for actions they are taking, others would criticize governments for their inactions. And so, as you said, I've been quite critical of my government, basically because we are faced with a global pandemic. And we all know and acknowledge the fact that different countries are faced with different scales in the level of infection. But that does not take away the fact that it's still a health crisis, that every country must deploy its best strategies to sort of counter the spread of the coronavirus. For us here in Ghana, what we've seen is that we recorded our first cases in the last 6 weeks. And since then, we as a political party, which is the National Democratic Congress, have had to close its borders, to close our borders, because we all know that from the onset of the crisis, no country had the coronavirus starting from its own home country, apart from people traveling from China and other countries to our individual countries. So we advocated for the borders to be closed and for government to take adequate measures to ensure that the spread does not escalate. But we saw that our government delayed in implementing these measures. So we moved from case count of 2 to where we have at the past week having a little over 500 cases. And as I speak to you guys now, we have over 1,000 cases. And this goes back to what you said, that you, Clémence. I think that we need to acknowledge that as countries, we have varied responses to the coronavirus. People are thinking about the economic ramifications of the pandemic and how countries in the developing world have to brace themselves to address the challenge. But if we want to put the economics before the health, then we would come back later on when the crisis is full blown and we cannot manage the pandemic to have to now deal with the health crisis. And this is why the National Democratic Congress have sort of called on government as of yesterday that there wasn't the need for us to lift the ban on the lockdown that the president introduced some 3 weeks ago. But unfortunately, our president, Nana Akufo-Addo, actually has called off the lockdown and has asked that we can go about our normal activities and still observe the social distancing protocols. But that is not to say that we have found a cure or there's a solution. The problem still exists. 3 days ago, before the announcement of the lifting of the lockdown, we were at 800 cases. So if within 24 hours, we are over 1,000, how are we saying that we have the situation under control? And because we have some people agitating about the economic situation of the country, for us to go about our normal activities as though there wasn't any pandemic. I was listening to the news today, and the reports from the cities is that it's business as usual. There's no social distancing. 1 out of 10 people are wearing a mask, and so we are not seeing the health protocols being adhered to. And that begs the question that at which point do we begin to hold our governments accountable for their failure in addressing this pandemic in a much more aggressive and consistent manner to what the WHO has said? And I know that a lot of people advocate that, yes, for the global south, for African countries, we are faced not just with a health pandemic, we also have economic crisis looming. And I say that, yes, we have an economic crisis, but we are fortunate that the scale at which we are seeing the infection in our countries is not as dire as we've seen Italy or Spain or the UK or even China. But that does not mean that we should relax our measures to sustain the containment of this pandemic. And that is why we as a political party have advocated that the government must step up its efforts and not just say that, look, big people are agitating, and so we are going to open up the country. The question also is, we dedicated some monies to the government for the fight for COVID-19. The government came out to say that they are committing 2 million Ghana cedis daily to feed the vulnerable. For me, that came to me as good news, because then at least we are not saying that we are locking down and leaving the vulnerable people to their fate, but that the state is providing for them. But what we've seen is that even though we made these monies available, there have been reports that the foods or the materials that are being shared for the vulnerable are being shared based on political party affiliations. I mean, there has been some denials by the government, but that goes back to the question of systems, that if we do not have systems in place, then, and we are faced with this pandemic, then we would find ourselves in this situation where we are living by the benevolence of politicians and people trying to choose probably their party faithfuls over.
Oh, I believe the internet connection of Benedicta is wavering a bit. Sorry, so I'm going to switch to the other question. Indeed, as you mentioned, the difficulty of when there is no mandatory lockdown, for example, makes it so that it's not the most vulnerable who are being protected, because as we know in big companies, for example, the CEOs, etc., the people who are vulnerable but are also rich do have the possibility to go on lockdown by themselves and self-isolate. But the people who are on frontline, the people, the workers, the people who have to go to work if there's no actual lockdown, even if there's no mandatory activity, they are the ones who are going to be the most vulnerable, and they are the ones as well who cannot afford a health coverage if necessary. Benedicta, if you want to conclude, or should we move straight to Camila? I can't hear you, you have to unmute, sorry.
Yeah, just to is just as have been recounted by Saima and João in Brazil and India. We have a situation where now the lockdown is no more in place and people are going about their normal activities as though nothing is happening. And we hope, against hope, that we would not see an escalation of the spread in the virus, because of the limited health infrastructure that we have as a country, we are likely to have a serious crisis on our hands if the pandemic is to grow, if we are to see the increase in cases. And so it's quite unfortunate, and our party has stated its position on the matter, that we are against the lifting of the lockdown, but it has already happened, and we are hoping that the numerous campaigns will yield the results. But it is quite, as I said, it's quite unfortunate, and we must see governments across the world prioritizing health as opposed to economics.
Thank you. And another point that, as I understand from your intervention, you make is the difficulty of governments placing themselves as the truth teller or the decision maker, when really one could also make the choice of saying, okay, the experts need to decide. In France, for example, since this is where I come from, there was a whole debate about a medicament being used or not, whereas it is supposed to be an expert question, but the government, instead of leaving the expert and the health professionals deciding on is a lockdown necessary or not, as early as possible, of course, because usually the health professionals are being conservative about that in order to protect the health of the majority. They take the lead and they make it a political decision, which therefore balances indeed economic situation with the health situation, which then can be detrimental, is detrimental usually to the most vulnerable. And then what happens is that our health system, as you mentioned, Benedicta, as well, are being proofed and tested, and sometimes it can lead to disastrous situation, as probably you can tell us about, Camila, in Ecuador, where the health system was not strong enough and led to a disaster as to the handling of corpses on the streets, particularly.
Yeah, of course, as you said before, I think that this pandemic showed us how is the inequality, just not in Ecuador, just not in a country or a sector, it is around the world, because it is happening, as we can talk and know about. It's happening around the world about the inequalities, and we have to ask us who are the people that are dying now, because they are the sectors that are more vulnerable in a lot of kinds of stuff. For example, in Ecuador, there is a country that is located in South America, and it had a population of 17 million of people. We have also like 10,000 of people with COVID-19, and in this number of people, we have 500 people who died with this COVID, and also we have another kind of number that is 800 of people that died with probably symptoms of this COVID. But almost, for example, here in Ecuador, we have Guayas, that is one of the provinces that it has the most inequality, social and economy kind of inequality in Ecuador. And this province is the most affected in the country, because it has 7,000 of people who have COVID-19. And it was recently a study that showed us that just in 15 days from 1st April to 15 April, just Guayas has 10,000 of deaths just there. That it not in this number of people who die with COVID-19. And it is a really worrying thing, because it is like a really big, a huge number of people who are dying. And we have to remember there is not just a number. There are people who have history, who have family, it's supposed that they have human rights, but it's something that is not happening at the moment in Ecuador. A difference to Brazil, but in a kind of really similar to Graham, the government take a lot of sanitary measures, really hard for everyone. I suppose that these sanitary measures was taken to prevent the COVID-19 in Ecuador, but it's not working well for everyone because the inequality shows again and appear again in the system. For example, in Ecuador at the moment, we don't have like public transportation. We can go out our homes until 2 p.m. As around the world, the education and the works goes to the virtual world, and now you need to have an internet. But it's really hard that all the population must to do it well with the studies or the work, because here, for example, in Ecuador, we have 46% of informal work. So it means that people who don't have like a formal work, people that need to go out, who needs to work, to eat, to live in a place. So it's not easy to these people to get in their homes, because they are asking themselves, and it's something that we watch on the news. They say like, okay, I must decide if I want to die with COVID-19 or I want to die because I don't have nothing to eat. So these people decide to go out and put themselves in risk. And it's really hard. For example, the education, the works, we in Ecuador have a lot of communities that even don't have internet, because at the moment they are fighting against extractive projects, are fighting because they want like safe water, are fighting because they are protecting their territories, they are protecting the nature, they are protecting different kind of facts. So it's not like a moment that they are fighting because they need internet. That is something that is connecting us. So at the moment, the indigenous communities, for example, from the Amazon of Ecuador, they are not in the media. We are not, we don't know what is happening there, because they don't have this human right that is communication. So it's really hard because, okay, we have like sanitary measures, and we have different kinds of stuff that we must stay at home, and it's really beautiful to be in publicity and that kind of stuff, but it's not like the real situation that all the people in Ecuador and probably around the world are living at the moment. And that's the reason these people go out their homes and get sick, and obviously the system public of healthy we're not working, not just now, because it is a problem that was before, and we can't like just cover the sun with one finger, because it is not like something that it can solve in a second with good ideas or something like that, because it's something that must be worked like for years and before. And that's the reason that we must ask, for example, as in Wambra, that is a community media, and we ask who is the people that are dying now, because it's not like this small group of people that can stay at their homes because they can buy food, they can have different kinds of privileges, but they are the most of the population who this human right that is supposed to be to everyone become a privileges. And it's not like a something that it's good for everyone. So that is what is happening now in Ecuador. We have sanitary measures that are really hard for everyone, but it's not something like everyone can be well with that.
Thank you, and we will answer the questions after covering a few questions. But the question of the audience we will answer after that. But starting again with you, Camila, because all the situation that you're describing, and as I understand it, the mismanagement from the government of the crisis. And that's a question I will ask to all of you, but do you believe that the agenda of your government changed since the start of the pandemic? Do you think they're taking advantage of the situation? Do you think it led to a better trust or or worse mistrust from the public? What do you think this relationship, how does this health crisis also attack the relationship between the government and the public? And yeah.
Yeah, of course. For example, yeah, the agenda of the government changed, but as I say before, it's not like just to make something well or something like publicity and try to cover all the problem with one finger. And something that shows this fact is, for example, that in March 24, the government adopt an international draft that it was of $3,024 million, and the Assembly of Ecuador and a lot of people say that that money must be used in the people to take care of the health of the people, to take care of the COVID-19. But the decision of the government was pay this international debt, and at the moment they are making like some trades, and they are making some loans with international monetary funds, with a lot of kind of international banks and that kind of stuff. And it is really worried because recently in October, as Ecuador, we have been a really huge protest, a really difficult protest where a lot of people died. And obviously we have in the same protests countries like Brazil, like Chile, like Colombia, that we were fighting against the international monetary funds, against this system, against these inequalities that are living all of this country. But at the moment, with this speech of say that we are in not only in a healthy crisis, also in an economic crisis, it's again show up like it's like we come before again to October, because now on TV, on the news, and the different policies that are taking the government, it's again like a neoliberal kinds of policy that the people fight before, but now it's appearing again. So it's really thing that we must think about and what we are going to do before, because it's something that a lot of people fight before. For example, at the moment, as I told you, in the Amazon of Ecuador, still the projects of trusted it at the moment is something that doesn't stop. So there are people that are fighting again in this quarantine, are fighting for them territories, are fighting for the water, are fighting of the life. So it's something that is really worried, that I know that is not happening only in Ecuador, because inequality is not just here, it's around the world, because all the countries are in a system that it shows the pandemic that is not working.
Thank you. And indeed, inequalities arise everywhere. And as we mentioned before, the mismanagement of this crisis, or rather the health crisis in general, highlights the inequalities and the inequality of the citizens in front of the health, in front of just basic social protection of being able to survive during a pandemic, having a wage, and for many, especially precarious worker, as I'm sure Saima, you also being quite close to the situation in Ecuador as to precarious workers and people who only get a daily wage, who all of a sudden cannot go out and work anymore and have to find another way to sustain themselves, or either get the virus or just die of hunger. Would you say, because I also read that Kemala, for example, the region of Kemala was handling the situation pretty good, which led to a decrease in the number of contamination. Would you say that with these two instances, with the general government in India and the situation in Kemala, that the government in India, or the governments in general, can have a positive action that reinforces the trust of the people? And would you say that that's what happened in India, or would you say that because highlighting the inequalities, it led to more mistrust from the people in India to the government?
Yeah, so there are multiple factors to this. So primarily, the government that we have is a right-wing government, and Narendra Modi himself has never actually ever given a press conference in his 6-year term, never addressed media directly. He either comes through the nationalized television network and delivers a speech, or sometimes sends a recorded message. So there's an immediate disconnect there. There's this very evident hierarchy there, where there's either there are people who are critical of him because of his lack of empathy towards his own people, or there's this group of people who blindly follow him because according to them he doesn't waste his time in things like press conference, addressing media, or discussing things with people. So right before the pandemic happened in India, situation in India in itself is not very good. We were going through a massive wave of civilian disobedience movement that had been going on since Actually, it instigated right after the situation in Kashmir in August 2019. But ever since the citizenship bill came, things were very turmoil. We had, right when the pandemic, before the lockdown, in fact, we had completed 100 days of civil disobedience movement against the government's biased citizenship amendment act, which discriminated against the Muslim community. And there were massive riots in one part of the capital of the country right before the lockdown, and we were heavily engaged in the relief work for those people, trying to rehabilitate them when the lockdown happened. The lockdown was announced at a notice of 4 hours. So a population of 1.3 billion people, with most of them being daily wage workers or people who are migrant in their own country, the duration that was given to the people for the lockdown was 4 hours, and that led to massive panic buying and general mass hysteria among people. Ever since COVID-19 has came to India, we have lost more than 200 people have died while walking back towards their home from major cities. We have lost 559 people due to the COVID virus, and we have lost more than 200 people just because they were walking back towards their home and they couldn't reach their home. They died because of hunger, because of exhaustion, because of police brutality. So there have been like all these inequalities in India existed. In fact, one of the latest research report from Oxfam says that India's richest 1% have 4 times more wealth than the 70% poorest people in India itself. So there's massive disparity in terms that has existed for a very long time, which has been highlighted during this pandemic. The government has taken, the government is very well aware of these things existing, but they have rolled out these schemes where they're giving the poor people some kind of stipend money, which is basically a little more than $5 a month for 3 months. It's supposed to give them roughly $20, but they decided to give that $20 in the span of 3 months with equal installments per month. 2 people have actually died waiting in the line at the bank to get the money out of hunger, because they stood in the line for so long and they couldn't even get the money. And they died. So these kind of things are happening. People have died while they were waiting to get government sanctioned ration and food. They have died waiting in the line. People have committed suicide because of hunger, and most of the poor people have actually come forward, like in most of the other places as well, where they have said that it should be left to them to decide whether they want to die of the virus or of hunger. And there's a very prominent chance that they'll die of hunger first before they can even get the virus. Other than that, there are other problems also, in terms that we have a population of 1.3 plus billion people, and we have had 291 tests per million. That is shamelessly a very low number to do tests on, particularly in a country which is very densely populated. Social distancing isn't really an idea that goes well within the Indian culture also. It's not just about education, it's just the inherent culture in India, that diverse mingling culture in India doesn't really understand the concept of social distancing. It's a very niche privilege for a lot of people, so that doesn't really pan well anyways, and this disparity has just made it worse for a lot of people. And India in itself is a quasi-federal state, so there are state governments functioning, they're doing things in their state, and then there's a central government that looks after things. Like you mentioned the case of Kerala. So Kerala government, when the central government announced their first stipend, their first set of stipend money that they were going to roll out for the people, that was actually way less than what Kerala government had decided to roll out for their people of their very own state. And Kerala has been Kerala has very smoothly been able to flatten the curve in the state, and they've been having they just had 2 deaths. In fact, Kerala has had Kerala was the first state that that had the coronavirus case in India, where students from China had come way before it spread all across India. That was at least a month before it happened in India. So they're already, and they had a massive virus outbreak in 2018. So they had prepped up their system back then itself, and their caregiving sector was so prepped up before the virus came. They, even today, when the situations are so much better there, they're very much prepped up in terms of facilities and care. And when the migrants started going back after the lockdown was announced, Kerala state government decided to call them guest migrants and not see them as burden. They irrespective of where the people came from, they gave them certain amount of stipend money. And an interesting thing that the Kerala government did, which stems from empathy, is that they realized that these are poor migrant people, and all they care for is to be able to get some food and have a way to connect to their family. So Kerala government decided to roll out a plan. What they did was they got a service provider, and then and they recharged every migrant's phone. So like there's a definite way of connecting to your family every day. Then they ensured that there was because India has multiple cuisines and it's such a diverse country, they decided to bring in multiple cuisines for food also, so that they can engage the migrants also. The migrants wouldn't get bored by eating food that they're not used to. So they brought in different kinds of food. They even brought in board games and all these kind of things to keep them busy and engaged, and to ensure that the government was with them, and they were their guests, and they would take care of them till the crisis was settled, which is something that should have happened in the country, all across the country, because in times of crisis, the bare minimum that the people expect is that the government will take care of them, will show them empathy, have some compassion, at least feed them and take care of them, which is not really Narendra Modi's style. He's more into flashy things. He likes to make statements and leaves it to the other people to follow it up. He did the same with the lockdown also. He just announced a lockdown with a 4-hour notice, and the state governments were left to pick up the slack and do the actual work. Then he set up a fund which is called he named it PM Cares Fund. And in India we already have Prime Minister Relief Fund, which is kept aside for such kind of situations. But instead of using that, he set up a different fund where there's zero transparency, and he and his trusted people are part of it, and that has had millions of dollars of money in it right now, and there's no accountability for the money. He even made it that money tax-free also, so people who donate to the fund will get tax exemptions, but people who will donate to the Chief Minister Relief Fund will not get tax benefits. So it's inherent, people will go for things that will provide them tax benefits. So he, in the middle of the pandemic, he decided to go that way. And then there's this another factor in India which has been brewing for a while, which is this Islamophobia. So it has been happening for a very long time, but in the middle of the pandemic, we thought that because of the anti-CA protests, we've been able to make protests interesting for the youth again. The youth especially, the protests in India were led by women as old as 90 years old who have never literally stepped out of their homes ever, and they decided to come out and fight the government for these protests, because they're like, India is our country, we need to have the right to stay here. And we brought in all these kind of goodwill capital for the Muslims. We tried to humanize them amidst the crowd because of the rampant Islamophobia in the country. But in the middle of the pandemic, somehow in the whole wide world, people are looking to find vaccines for the country, for the virus. But in India, people are busy trying to find the religion of the virus, and they have shamelessly decided that the virus is Muslim. And now that has led to because there's this Tablighi Jamaat incidents in Nizamuddin. Tablighi Jamaat is an Indian missionary organization. I think if you look into Malaysia, in Malaysia also there's this congregation which led to, which had cases, a spike in cases after that congregation. Similar kind of thing happened in India, but the problem was that there is massive misreporting on that, so much so that like the very first day they said there were 18 people positive from that incident, and that news was debunked the very first day, but nobody has picked up on it. And since then this has just been a series of things. So they'll use, so if there's the people in question are Muslim, they'll say they're hiding. They use words like hiding, you know, or like violent or not cooperating. And if there's people from another community, they'll say, you know, they're stuck, you know, they need help. So they're just building us versus them in the middle of a pandemic, which has resulted into massive discrimination for the Muslims in the country. Like because of the pandemic, already other kind of healthcare has to suffer, and on top of that, Muslim patients in particular have to suffer. Just yesterday itself, a cancer institute had rolled out a circular in a newspaper saying that any Muslim patient who wanted to come there and get treated, they needed to have a COVID-19 negative report with them to prove that they were not positive with the virus. Only then they'll be allowed to be treated. Where healthcare is a basic universal thing, like nobody can be denied healthcare just because they belong to a particular religion. But in the middle of everything, this has led to a lot of disharmony, which has resulted into a lot of distrust between people, and distrust between the government and people, which has ultimately resulted into a lot of violence towards the primary workers, the healthcare workers, the primary food workers, against the police, because there's so much mistrust for the government that the rumor mills just go around and people just get like there's a rumor going around that the healthcare workers are gonna come into the Muslim areas and they're gonna give them a medication that's gonna make them positive for the virus, and that aided the population there, because they were already so much on edge in terms of everything that's constantly on the news. Like every day the mainstream media peddles so many fake news. Like fake news has become the new normal here. You cannot trust any news that comes from the mainstream media, because you'll hear it today and by the end of the day it will be debunked by somebody with actual real facts, but the damage would already have been done. So in a way, the pandemic is somehow a very secondary problem for us right now. All the things that have happened because of the pandemic are actually more in focus. The poor don't have food, the poor don't have any ways to go back and get work. They have been kicked out of their rented homes. Even though the government has said again and again, but the landlords and the company owners have kicked out people and not giving them the money. There's this problem of the issue of domestic violence and child abuse has also erupted massively. In fact, there's been an unprecedented level of boom in child pornography's demand, which is like in the middle of a pandemic, which makes this whole home quarantine thing so hostile for a lot of children and a lot of women. So there's so many issues simultaneously being dealt in under this umbrella of a pandemic that for most of the people, virus is not really their major concern right now. Like if you give them a list of things, virus would probably fare at 4th or 5th place for them right now, because they have other major concerns to deal with. So to top it all, the government has been trying to, there's one particular act in India. It's called Epidemic Diseases Act, which was brought in by the colonizers in 1897, the British colonizers, which gives unprecedented level of authority to the government to handle an epidemic. So a right-wing authoritarian, tilted authoritarian government, when gets such kind of access through police and other authorities and institutions, that becomes a very hostile place for a lot of people. So much so that in the middle of the pandemic, the central government's police has actually been witch hunting Muslim student activists and Muslim civilians who were actually impacted in the anti-Muslim program that happened in February. So there's no like when the virus happened, a lot of people actually thought, that it would bring a pause to the Islamophobia that was there in the country, but it has just somehow manifested it more and has made country very hostile for a lot of people. Thank you.
Thank you. It's, of course, there's a lot of things to cover, but I do think that a lot of us in our different countries can relate to that, as to, stereotype population being called unruly when, a more bourgeois population will be say, oh, they couldn't resist to the sun when they do not, respect the lockdown in the media, etc. Or of course, democracy all around the world, government in front of this health crisis are taking are taking measures to reinforce their powers, to establish a state of emergency, and more often than not, leading to abuse of power and taking measures that are actually not temporary and will actually hinder the social rights or the rights of the workers or the social protection of everyone. And even though as you mentioned, the difficulty is that this crisis that started mostly in the global north will allow for some northern countries to allow for investment programs or bailout for people programs to happen, so that the social when they happen, of course, but so that the social consequences for the people is not as strong. But for many countries in the global south, that cannot happen because they lack the resources. Sometimes, of course, they lack the political will as well. But of course, the economic crisis that is going to attack the global south once the crisis continues and companies are being shut down is going to affect, of course, way more the global south than the global north on that aspect, and therefore increase inequalities. And as you mentioned, many bailout plans are being organized to more often than not, again, in favor of companies and not necessarily the people. And in some countries, they don't even happen at all, leading hundreds of thousands of people without any resources. So I think this health crisis really highlights the legal and social voids that have been present in our society for so long, with workers not having a sustainable protection, not being able to ask for unemployment, or not being able to have to even access to minimum wage because they're illegal, because they are precarious workers, or just because they're unregistered. So, well, not illegal, but they don't have papers. So, and therefore leading to huge blind spots in our humanity per se. And as you mentioned, it is also a political will to, for example, treat migrants, especially in this crisis, to treat them as your own and to protect them, because that's what you expect from your state when you pay taxes or not. But when you to take out, especially when it's health crisis and it's beyond us all. But when that doesn't happen, and in relation, the government is just using that as an element to promote anti-democratic measures, it's truly catastrophic. Very quickly, because we also have other questions from the audience, and we've already been talking for an hour, although I found this particularly passionating, and I do believe that the audience has the same feeling. Benedicta, as you mentioned before, you've been very critical of the government as to the handling, but also with everything that Saima said, and I saw you smirk when she talked about the discrimination that Muslim people face in regard with the coronavirus. And do you think that the region per se, or the Ghanese population experience such things, and that can lead to mistrust between populations or mistrust against the governments? Sorry, you have to unmute.
Yeah. I think that for the Ghanaian situation, we have not seen indiscrimination per se, amongst the different ethnic groups that we have here, or even foreigners within the country. I think when it started, because of what Donald Trump said at a certain time about it being a Chinese virus, we had a few issues of Chinese being out and people sort of harassing them about they being the cause of the virus. But I think that it's more of like a trickle-down effect of what a global leader supposedly is supposed to have said. And so we've not really seen that much of a discrimination in terms of race or ethnic minorities. What I would say, though, is that between political factions, there has been some level of discrimination, as has been alleged, that we are not seeing the government supports to people go to some of the areas that are considered as the stronghold of the main opposition party, which is the NDC, and that is a cause for concern, because it is not the political party and government's funds that are being distributed. It is funds for the nation, it's funds for the people, and so we should not see the distribution of those resources based on political party lines. When you also mentioned about governments putting in place laws that could have far-reaching effects, it just reinforces our position also, that if you look at the law that was instituted to enable the government exercise the emergency powers, that law is so far-reaching in its scope that it covers areas which has nothing to do with the pandemic. So you have issues of privacy and just discrimination that now has been alleged in the law courts, where a lawyer has actually gone ahead to file a case in courts to challenge the government and say that that particular aspect of the law is inconsistent with the Constitution. And so asking the courts to literally declare that part of the law as a violation of their fundamental human rights. And so it's not just about Hungary or other Western countries, but we also have not necessarily extreme cases, but we also have snippets of laws that have been quietly introduced into legislation that is sort of aimed as achieving some other results than addressing a pandemic. And those are some of the issues that we as activists and political parties have been interested in and must be interested in, because under the cloak of emergency powers, we could actually have our democracies destabilized. And it is up to us now to be the watchmen for the people and call governments to account for each and every single action that they take during this pandemic. You spoke about debt reliefs and stimulus packages. So far as Ghana is concerned, we've had the president announce that the next 3 months, beginning from April to June, that we are going to have our electricity and water bills subsidized. For the baseline consumers, they are having its weight totally. But then we are having a situation where a lot of people are advocating that the way in which these measures are being introduced is not consistent with the government's position on whether or not we should have lockdowns in the affected areas. Mind you, the lockdowns that we had in Ghana were not complete lockdowns. They were not nationwide and they were not complete. They were partial lockdowns in specific areas where the the virus was fast spreading. And we thought that that was prudent. And we must not begin to jubilate. We might not be quick to jubilate before we start seeing the successes. We must wait, and our government or our party has stated that at least give it some time for us to see that the measures that we took at the beginning of the pandemic are actually yielding some results. Because if we have a challenge on our hands now, it will not necessarily be the politicians that would be found wanted. It might be the middle class or the vulnerable in society who might have limited access to our healthcare system, because already, as I stated, our health infrastructure is quite constrained in terms of its capacity to deal with the coronavirus. And that is why it is quite imperative that we focus now on containing the virus from spreading, because the more we have the virus spreading, the more our likelihood of being faced with this challenge where we cannot cater for everybody when it comes to supporting people within our healthcare system. As a country, in terms of our government hospitals, we only have a total of 67 ventilators for 30 million people. So if we are saying that, yes, the lockdown has now been lifted and we should go about our activities as though nothing has happened, and we all of a sudden see a spike in the numbers, how are we going to respond to that? Thanks to the past president, who is our current flag bearer, His Excellency John Dramani Mahama, we as a party, whilst we were in government, did a lot of investment into the healthcare system and built a lot of hospitals. We revamped a lot of the smaller hospitals and upgraded them to secondary and tertiary levels of healthcare service delivery. And that has been the backbone for us during this pandemic. And we are saying that to the extent that this current government has not provided or has not contributed anything, whether you call it that, I mean, you mentioned infrastructure, or we've not seen them make any investment into the healthcare service. We think that to the extent that they've not made that much investment into the healthcare service, we should not be taking the risks of lifting lockdowns. Now, to the issue of the economics, as opposed to you, Clémence, who say that in the West, or for some developed countries, those who are coming out and flouting the lockdown regulation is probably people in the bourgeois class who want to see the sun and enjoy the fun. It's really not the case here. We are faced with a situation where you have low-income earners, particularly in the informal sector, who literally live on their daily earnings. And so where you have a situation where there's a lockdown and there's really no consumption, close to no consumption in the economy, they are strained in terms of their income. So these people are pushing for us to open up the economy and for governments to intervene in terms of supporting them. We are saying that, yes, government provide the necessary support. Let us look at ways of mitigating the risks for the vulnerable. But let's not say that because they are pushing for the lifting of the lockdown, we should, reduce whatever measures we have in place now at the risk of a spike. Because where there is a spike, it is all of us that are at risk. And you talk about the healthcare workers. We have a situation where, as of yesterday, we still had some hospitals complaining that they don't have the PPEs. And if we don't have enough PPEs for healthcare providers, how are we saying that we are in a better place as a country to open up and go about our normal activities as though nothing has happened? And so that is the inconsistency in terms of policy by this government that we must, and I would say that we must begin to call all other governments to be aware of, because you can't say that because we are faced with a situation where the finance minister has revised the growth rate from 6.8% to 1.5%, and it's an election year and they must prove that they are doing something or they are achieving something. We should open up the economy for activities or for workers to go about their normal business as though nothing is happening. Yes, our numbers are not as dire as we have in the US or Italy or UK, but our position in terms of our healthcare infrastructure and our preparedness and resilience to be able to manage this crisis is in question. And because of that, we cannot afford to take chances.
Thank you. And I think you mentioned many different very important topics. And I'm just going to jump back on one, particularly the democratic elements, and use a very stated example that, you know, everywhere the rule of law is being very much challenged. In France, for example, the Constitutional Council was asked to review the laws that were voted under the state of emergency, and the Constitutional Council, whose job it is to review the laws in front of the Constitution, declared himself not able to do so, because as it is a state of emergency, there's no need to respect the Constitution, which is of course horrendous for human rights and the rule of law in general. Even though that's of course a very important topic, I take this opportunity to tell everyone that in about 4 weeks we will have another webinar about the breaches of democracy in front of this health crisis. And as you mentioned also before, Saima, violence inside families and especially against women, of course, during lockdown, which is of course a huge topic. In 2 weeks we will have as well a webinar about feminism during this health crisis. So tune in for that. But moving on, because indeed we should make sure not to take up too much of our viewers, but we have about 2.5 more questions. So I will ask you to be a bit more brief, unfortunately. So João, I'm going to ask you the same question as before, just very simple. Do you think that the crisis has led to more criticism or more support for Bolsonaro's government? Are people who used to support him changing their minds, or do you think they are actually just supporting them even more? And I'm just going to double down with the next question and then we can follow up. How do you think the handling of the crisis by the countries of the North influence the situation in the South, in the global South, but especially in Brazil? For example, as Benedicta mentioned Donald Trump, do you think Trump's position influenced Bolsonaro's position very much? Do you think there's a lot of things that the northern countries could have done to prevent the spreading of the virus? That is all.
In matters of political support for the government or for the figure of Bolsonaro that is managing to become something different from his own government. During the past 3 or 4 weeks, he has even been rivaling his own supporters, his own ministers, that some of them, as the previous Minister of Health, Luiz Henrique Mandetta, he affirmed lockdown was necessary in Brazil and we should take more measures to contain people and to refrain people to go to work and keeping going to the streets. So Bolsonaro began like a dispute inside his own government with his own ministers and some of his supporters. What I saw, what we are observing in Brazil, that some criticism is coming, particularly within middle classes. The more informed, the more educated part of Bolsonaro supporters are outraged with his behavior, especially denying the disease is serious and going out to the streets to compliment some of his supporters. But the portion of Bolsonaro supporters that are still with him are becoming more and more radicalized during the time. So we are facing a universe where a portion of our population are becoming really aggressive to support Bolsonaro and support some elements of Bolsonaro's rhetoric, such as his support for military dictatorship or military coup, or close some of our democratic institutions, such as the Congress or opposition parties. So Bolsonaro is losing his appeal with some part of the population because he chooses to radicalize this crisis, but the portion of his supporters that are still with him are becoming more and more radicalized. What we are seeing as positive as we are managing as opposition to make more coordinated agendas, particularly to implement policies to prevent economic meltdown and to make people to have basic income, and to implement measures to prevent people for suffer more with the coronavirus pandemic. Almost all of the measures came from the opposition and was forced by the Congress to the federal government. As for the policies implemented by the North, I don't see how we could prevent pandemic to arrive in Brazil. We could be more prepared and share more information and have more mechanisms together. As I spoke in the first part, that this was going to strike Brazil really, really hard, because we have a huge traffic of people between Brazil and Italy. So we should be prepared, and we should cooperate more with Italy, while knowing how pandemic spread in Europe and even France, knowing how the pandemic spread and how we could prevent things here. As for the policies northern countries are taking, we are particularly concerned with access to necessary equipment, and how some politicians such as Trump are treating the problem within their own countries. As Bolsonaro is too much aligned with Trump, everything Trump says, he repeats here in Brazil. So medications and the discussion about a cure for coronavirus, when Trump's affirmed there are medications that could work to prevent that sort of disease, Bolsonaro will repeat here, and some of our population are going to, many people in Brazil are going to believe in it. We had some issues, I know France and other countries in Europe had with the United States too, while buying mechanic ventilators and masks. We couldn't receive part of the equipment bought because it became stuck in the United States and other ports. And it was a really clear example for us on how South-South cooperation should improve our conditions to face the crisis. The governor of Maranhão is a state in northern Brazil, managed to dribble to turn around the situation by buying mechanic ventilators from China and making them fly via Ethiopia to Brazil. So we, as some people say, while dealing with the South, many times we are looking to the South and trying to dialogue with the South by looking to the North. We don't realize we are that much closer in the South as we actually are. So some dialogue with other Southern countries are making possible for us to have access to basic equipment we couldn't have by flying then through the United States or through other ports. I don't know how northern countries are going to manage to present solutions or cooperation to southern countries, because as economic crisis is going to hit those countries as hard as it's going to hit some of the countries in the South. I don't know if they are going to have resources available, but we hope we can cooperate in terms of knowledge and elements to combat crisis here in Brazil and other southern countries too.
Thank you. And indeed, one of the highlights of this crisis as well was how international solidarity in very many instances is failing miserably, and how this modern globalized world that has been sold to us through saying how globalization is very good, capitalism leads to, you know, stronger connection, etc., is also showing its failure through, you know, for example, the US hoarding on necessary resources for many, many countries, but also within the European Union, of course, you know, some countries holding some, you know, masks delivered by China for Italy, for example. So this is truly a moment of truth for everyone. And this is also why we decided to launch these webinars right now during the crisis, because we do believe that during this moment, as we also see that the, you know, international left is failing in that instance of having a voice and yeah, providing for an alternative, it is important that we do get to discuss, we do get to exchange, and to, you know, organize this international solidarity. But maybe Camila, you would like to add as well something about what we just discussed, the relationship of the reaction of the South in reaction to how the North handled the situation, and how you thought that affected the handling of the crisis, and what could have been prevented if the situation would have been different.
I think that something that is really worry about that is like some countries of the South Global still are like exporting raw material. And it's something really particular, because in these cases, this raw material, they came from these old territories that are, as I told you before, fighting at the moment for fighting for a territory, fighting for food. And this exporting of raw material just support the system that takes care for small groups of people, of powerful people around the world. Because in some cases, for example, in Ecuador, it's not just in Ecuador. As I told you, the situation of Guayas is one of the provinces that have the most difference in inequality in the country, and it's because in these provinces we have like the most powerful and richest people in the country, but obviously we have the most of the population of Guayas is the poor people of the country. So here it doesn't exist like a middle class, and this is the reason that maybe it's the reason that theirs is like the most problematic part of Ecuador with COVID-19. So as Ecuadorian, as a woman, I think that is a really big problem, that as a countries, we are still solving the system that is not working for us. It's not working for a lot of parts of the world. It's just working for a small group of people that now is the people that can be in a quarantine, that is the people that at now can have like the implements that if they take the virus then can be healthy or something like that. But it's not like the case of a lot of part of the population. So as a lot of communities, as a lot of indigenous communities, as a lot of women, as a lot of feminists, now we think that we must think about a different way to live. Its pandemic show us that it is not working for everyone. The system of consume, the system of just export things and exploitation of the territories, exploitation of the woman's body, exploitation of laboral, exploitation of jobs, and different kinds of stuff. So as a group, as a feminist, as Ecuadorian, as a South American, we think that we must to propose a way to live more inclusive, be more respectfully with our lives, we must respectfully with nature, with more respectfully with resource, because they are the things that now are taken like part of the bill, for example. And that's really worse, because now this kind of vulnerable groups of people are paying all the consequences of this inacceptable system that is working around the world. So to be fast, that's it, is to be more inclusive, to have international, for example, a kind of support to give to these territories, to give to this person, to give to these communities the implements, because they must to demand and they must to say what they need and what are the demands that they need, and what are the human rights that they don't have. Because as I told you before, in this part of the point, the human right that is supposed to be to everyone becomes a privilege for a lot of the population, and just like a human right for a small group of powerful and economic and social powerful groups. So it's better, and we must to ask us what we are going to do before this pandemic, because as COVID-19 show us that this system that we were doing for many years is not working and is having an inequality that is killing a lot of people, the vulnerable groups of people.
Yeah, thank you very much, and I think you're completely right in the way that it forces her to rethink everything. Even in Europe, as I mentioned before, we had even before different levels of citizens. You know, people, exile people, migrant people being stuck in camps for the longest time in Greece or in the borders of Italy, having crossed, you know, the Mediterranean Sea at the peril of their own lives, now being in the middle of a pandemic, having no access to clean water, being in very, very precarious health situation, and most European countries considering that this is not a priority or this is not an emergency, and you know, closing borders, making sure that they protect their citizens, and not even very well, to be honest, before everything. And this is where the, you know, the thesis breaks. This is where it doesn't work anymore, because if you do not, you know, protect the most vulnerables, then you do not protect anyone, because it starts with the most vulnerables and then goes up until only the ones who have the ability by themselves, through, you know, financial conditions particularly, to save themselves, are being saved. And this is a terrible situation. This is a very scary situation. I, for one, I am pretty ashamed of the way my country has been dealing with the crisis, but also the way that we have been dealing with the most vulnerables, especially, you know, as we have for the past years, but especially during this health crisis, the way that we handle, you know, homeless people, migrant people, people who do not have a home, people who do not have a job, etc. And as I understand, it is also the case in all of your countries. But I'm very hopeful when I see so many, you know, people having so many of these experiences and willing to take a stand in favor of protecting these vulnerable people. It makes me feel better, though you know, this topic is of course very, you know, sad. Just to close up a bit before the last question, Benedicta, if you wanted as well to talk about the affection of the handling by the north to the south, and then we can move to Saima, of course, and you can tell us as well more about you know, migrating populations.
Yes, I think that the importance of solidarity during this pandemic cannot be understated. Solidarity during the pandemic, but also solidarity as trying to mitigate the consequences of what the pandemic will cause. For a lot of developing countries where you currently have heightened levels of inequality, poverty, unemployment, our inability to handle this crisis in a comprehensive manner would have severe social and geopolitical consequences for us all as a continent, and also internationally for Europe or for America or any other developed country. Because if we have a situation now that you don't see a lot of health issues coming to the limelight as we've had COVID-19, and we've seen a lot of people being displaced, but it's not been because of health, for instance. If we are not able to manage this pandemic in a way that ensures that the less privileged or the developing countries are also able to contain the pandemic or the situation, we are going to be faced with a situation where maybe the developed countries would feel that they are having a solution to the pandemic and managing their crisis. But if it explodes in other countries where their healthcare systems are challenged and cannot manage the crisis as would be expected, what you would then see is we would have a wave of uncontrollable migration from developing countries to developed countries, or perceived developed countries, whether even within the regions or across regions. And this is why it is imperative that we call on international organizations as well as international companies and governments to not focus solely on their national solutions for their people. We know that, yes, everybody now is focused what they are doing to ensure that they contain the virus, but it is important also that a hand is extended for those countries, those economies that cannot go through this pandemic as we see it happening in Italy and Spain. We must be able to support countries in the South for them to be able to manage this pandemic in a way that does not degenerate from a health crisis to a full-blown socio-economic crisis everywhere in the world. And that's why I think that the webinars like this is quite important for us to bring the issues that are of importance to the rest of the world, to the attention of world leaders, that yes, we are all focused now on internal measures that countries are taking, but if we do not make those hard decisions of investing in health in the developing countries, their crisis would also translate into crisis for the developing world. So yes, there's a need for solidarity amongst us as individuals, as people, as societies, as communities, to support each other and extend helping hands to those in need.
I believe Benedicta's connection is also breaking a bit. Just to jump up on what she mentioned. Go ahead, but sorry, the connection was breaking.
Yes, so beyond national solutions, there's a need for us to also begin to look at how to extend that same solidarity to developing economies for them to be able to weather the storm that is fast becoming a full-blown pandemic, for instance, in Ghana and on the rest of the continent. And I would hope that we also begin to see that we don't just wait for pandemics such as this to happen, for us to advocate for governments to make the needed investment into the healthcare systems and to build resilient systems that can better manage a health crisis if we are to have it again.
Thank you very much. And it makes me think about another fact about particularly paludism being one of the most deadly diseases in the world, and the fact that if we, at least if the world contribution on research in order to find a remedy, if half of it was put into prevention, we will not have paludism at all anymore in the world. But because, of course, if you develop meds and then you can sell them, then the pharmaceutical industries gets money from, developing cures, whereas prevention does not bring anyone's money except for, the lives of the people being protected. So indeed, investing in prevention and investing in a sustainable healthcare system is important. And I do believe that for once, well, not for once, but since a very, very long time, there was this idea of pandemic happening in certain parts of the world, mostly South, and therefore the North not really being concerned with that. That's what happened with Ebola, for example, with the northern countries not really being concerned about it, or at least not investing as much because, that did not concern them, or not as much. With COVID, at least now we are all concerned, we are all, contaminated to certain extents, and you have northern countries willing to, invest in in finding a cure or protecting populations, unfortunately, it does not yet allow for international solidarity to happen. But indeed, the efforts of the South are only going to be able to actually have a relevant action if it is supported by northern countries who have benefited for centuries of the natural resources and the people from this particular from the global South in general. Thank you very much, Benedicta. Saima, if you wish to say something, and then we'll conclude with one last question, but a bit of an interactive one.
Yeah, so like talking about this whole global north, global south relationship, India particularly has had a very interesting place, especially in recent times, because of like India being hub for diseases like it's a tropical country and a developing country, so it has like massive outbreaks of malaria and cases of tuberculosis. So India in a way has prepped up for that for a very long time, so that has made it into a leveling field for India right now in terms of hydroxychloroquine being demanded or asked, or whatever terminology people have been variatingly using for Donald Trump's request for the medication, and India subsequently agreeing to do it. However, they have decided not to send it before, but when Trump asked for it in a there's a debated idea over it, how he asked about it, but India subsequently allowed to happen. Also, in terms of the medication was sent also to Britain and also to Brazil, and India has also been sending out supplies to other countries as well. But in terms of sending supplies, India has somehow, there are instances in India itself where the supplies that were meant for certain states in India itself have been diverted and sent to the US. Or while the healthcare workers in India were actually using garbage bags as PPE kits, those things were sent to other countries to maintain these relationships that we've built up in this new capitalist world. So those are the equations that have been questioned in this pandemic particularly. This whole equation of what kind of relationship we've had, who do we call friends in terms of the global context has been questioned massively during this pandemic. This whole understanding of what a friend means has changed. Like say take the case of SAARC, which is South Asian Association of Regional Cooperation. So the South Asian countries, which particularly has Afghanistan, Bangladesh, Bhutan, Nepal, Pakistan, Sri Lanka, Maldives and India, all these countries. So we together constitute around 0.5% of the total deaths that have happened due to the COVID-19 virus. And but these SAARC countries have come together and they have set up this SAARC COVID-19 fund to amp up research and to help out all the countries together. These countries who are seen as poor, developing and often neglected in primary these massive healthcare technological development and advancement kind of things, but because of the major exposure to diseases like tuberculosis of malaria, the immunity somehow has worked up its way in countries like this, which has somehow seen a relatively stagnant growth of the virus in these countries. So the countries are putting in their money to research these factors and to building regional solidarities as well, a regional way to cope up with things as the dynamics internationally changes in terms of who we treat as allies or who we see as threat. So it will be I cannot agree enough with Benedicta in terms of solidarity and the need for it, but also this pandemic has helped us rethink about all these things that we as people on the left side of the spectrum have been trying to talk about and build it into the consciousness of people through all these years of work. But due to the pandemic, somehow it has become the main focus now. Like people are talking about universal healthcare, wages and all these kind of things, and questioning the big powers that was supposed to, help us in the South when things went wrong. We're supposed to see them as people who were supposed to be leaders. But surprisingly, leaders have come up from places like New Zealand. So, like, the dynamics have entirely changed. So, that will be an interesting thing to see in the coming future.
Yes, the Prime Minister of New Zealand, who, as I understand, was also Vice President of UZ once upon a time, as Benedicta is. So maybe this is a good news for the for the following. Just before we finish and I conclude, one last question, just in 4 words, or at least in 2 to 4 words. How can we keep on being activists during this pandemic? What are your experiences? But also, how can we be international activists during this pandemic? So if you all can just, in 4 little propositions, give our viewers ways for them to keep on being committed and helping each other out. Go ahead. Benedicta, if you want to start, and then we can switch to Camila, Saima, and João.
Yes. So how can we, as activists, ensure that this solidarity is not just kept in the webinars that we're having, but also extended beyond our online discussions and also on the ground? I think that for each and every one of us within our political parties, we must begin to have the engagement of what is it that the party decides to go for in terms of policy dimension. We must begin to critique those things. We must also begin to show solidarity, not just for what is happening within our own countries, but to look beyond our borders and offer a helping hand if we can, or not say that as COVID-19 has shown us all that we don't necessarily need to move to get our voices heard, and we can do a lot more within our own countries through the internet and other means that we are disposed to not just sit and say we would wait until the pandemic is over before we start our various engagements. We must continue our activism. As Clémence mentioned, I'm Vice President of UC, and as you would know, UC is still, we are still engaged in our activities. We are having a student working group meeting sometime next week, which we would be holding on Zoom as well, and trying to connect people across the world to have discussions on our core issues, but also look at how those issues relate to the current pandemic that we have on our hands. So yes, we are all locked down or somehow restrained in our various countries, but we shouldn't see that as limiting our ability to remain activists. This is where we must be innovative in our approach to be able to champion the causes that are so dear to our hearts and we value and cherish as a people. And I think that for most of us also on the left, these are challenging times to reflect on what our political parties have done in the past and what we are doing to address this pandemic. What has been our response? Because known to be the political parties that put people first. And so that must be the foundation for our activism in this era. And we must be able to call out leaders who are taking advantage of the systems and trying to enact laws that do not support the democratic credentials of our individual countries. And so I think that
okay, I think we lost her again. But
by and large, what we're doing and trying other ways to champion our various ideas.
Thank you, Benedicta. We lost you a little bit, so that's why I sometimes take the mic, because the connection doesn't always work, at least from my side. Well, I think indeed, as you mentioned, there's a lot to be done. There's still people who work during this lockdown. There's people who don't work. Camila, you mentioned as well the internet breach that can happen in Ecuador, and that is a huge problem in terms of communication and feeling close to one another. Do you have 4 tips as to how to keep on being activists during the lockdown, even if we cannot gather, of course?
Yes, of course. I think that have this kind of panels, this kind of spaces to talk about what is happening in our territories and in our spaces is really important, because we know that we are not just in an individual problem of an state. It is a problem that is around the world. And for me, it is really important because it shows that we must be together now and work together, making different kind of workshops, making kinds of works that can become to think in a community, because it's hard when you grow and born in a system that is completely different, because it is showing that you must be individualist and work and fight for yourself. So it is like a really good idea to think in a community, in a group, and work about us. In my case, for example, as a journalist in Wamra Media, it's really important for us to show the people the other stories that you are not going to see or watch on the traditional TV, on the traditional channels or the traditional media, because before this number of people that are dying and the government is given, there are people who have a story, there are people who have family, have different kinds of situations. So it's very important for us as a community media to show the world what is happening here. And as an activist, I think that it's really important to propose things, to continue working. Now we are in quarantine, but with the internet, we can still work for that. We can propose the people to be citizens with all the policies that are happening in the different countries and in the different territories against the injuries. As a woman, I think it's really important to take in us. It's really important to show us that the violence of gender is still a really big problem. For example, in Ecuador, this pandemic show us that we have a really increase of violence of gender. And it's really worried because it was a really huge increase. The people call us to the emergency sectors saying that because they are women that are at the moment living in a quarantine with their people who are hurting her. And so this is a really worry fact that we must to show to the world. And as a person, I think we must to work and be together and propose a different way to live now.
Very well, thank you. As for me, I was going to rather say, you know, how to be activists during the lockdown, reading, connecting with one another, watch webinars on political situation and the response in front of the crisis. João and then Saima, if you want to answer the same question, and then we can conclude and let Saima go back to sleep, I believe, or wake up for her day, because due to time changes, it must be either early or very late for you tonight.
Great. As a way for us to mobilize during the pandemic and during quarantine, I would say we need to make solidarity as the very basis of our action. Instead of believing, as many people have believed, the competitive heaven, neoliberalism and capitalism proposal, we see that is really flawed and is costing people's lives. So by acting within our parties or our organizations, if you can look in solidarity to our very communities, to our neighbors, and try to organize them during this crisis by make work to produce necessary products to be used in the crisis, or to share information to inform people on how to prevent problems caused by COVID, or to share information and gather information from people, as Ecuador and other countries. Brazil is facing a boost of gender-based violence during quarantine. So if we can organize network with women so we can share information and denounce and prevent these measures, it even if you can leave your home, you can do a lot of work, meaningful work. As for international solidarity, we should watch those seminars, talk more about each other on how crisis is impacting our countries, and not only try to think of measures we can apply or use right now, but enjoy this moment so we can understand how things can impact us as a whole, as humanity as a whole, as human race as a whole. And I cannot stress this enough, state and social-based policies are saving lives, as the one that's saving lives now. So we should defend universal health systems, because those are the structures that are saving lives right now. We say here in Brazil, 3 basic actions you can do to prevent the impact from pandemic: stay at home, wash your hands, and defend universal healthcare system.
Thank you, Joe. And Saima, if you want to also address the question.
Yeah, so like one of the basic things that we've been doing during this lockdown, and since we locked down separately, is like a very simple thing that we've been doing in India itself, and something that we can do globally also is check on our friends. Like just say what's happening in your area, what's happening in your country, what are the issues that you're fighting for, and as this like. There cannot be enough information ever, and knowledge is power. So we need to keep sharing information that the problems that different countries have been having, and to bring it into conversation in other countries as well, because that's how you build global solidarities. That's how you build global pressure as well. That you pick up a problem that say another country is having, and then you try and have a conversation about it in your country as well, and see find similarities, similar problems there, and then work collectively towards finding a solution for that. Another thing that we've been doing a lot is revisiting a lot of feminist texts and political thought texts, because we've had a lot of time, and Zoom has come out to be such a blessing in this time. So we've been holding all these online book readings and all that, where we've been reading feminist texts, we've been reading original political thought and discussing about things, and simultaneously building a new generation of young activists. We've been trying to lure them into politics, we've been trying to lure them into activism, we've been trying to lure them into asking questions. And that is something that like asking questions, because in India particularly, you either support the government or you're an anti-national. There's no middle way. So we've come to realize how important asking questions is. So that has become like a very basic thing that we've been doing, like in the middle of the pandemic. We've been asking difficult questions that a lot of people will not ask because they're in awe of their leader. So you have to ask questions. You have to ask questions not just for your country, but also for other countries, and to bring into notice all these issues. Also, lockdown is literally the worst time to flare up all the discrimination that minorities or marginalized communities face all across different countries. So this can be a time to bring into attention of those issues as well. Like, we need to talk about problems that other people are facing, or how poverty is such an equalizing factor all across the globe. So we need to check upon our friends all across the world and bring it into attention, and not just hold webinars about it, but also talk about things in our individual communities as well, so that we can maybe work towards a collective global solidarity and pave way for a global solution as well.
Thank you very much to everyone. As you mentioned, a lot of times in these crisis times, it is considered that it's either you with the government because you're on the side of health, or you're against it. Well, you're either in favor of the nation or against it, etc. And I do think, especially as young people from the left, we believe that if you do not have a democratic discussion on the politics and on the handling of the situation in the worst times, then your democracy is not protected in the best times. So now more than ever, it's very important that we get to have these discussions, we get to interact, and we get to criticize what is being done, because these are political decisions that we get to say in this as citizens and as inhabitants of this world, I guess. Thank you very much, everyone, for coming. I thought it was passionating. I understand it must be either very early for you or very late. So I'm not gonna make that linger even more. I found this discussion particularly interesting. We had a lot of interaction. Thank you for all the viewers who asked questions and who, of course, came to watch these debates. And as I mentioned, in 2 weeks we'll have a webinar about feminism in times of this global crisis, and in 4 weeks we will have another one on the breach of democracy and the threats to the state of law, the rule of law, sorry. So here you go. I hope you had a good time. You found it to be a fruitful conversation, and we look forward to discussing with each other again very soon. Goodbye.